Hi, everyone. Welcome to today's topic of discussion, which I will be talking today specifically about the health and wellness area of managing your diabetes. Lately, I've been hearing a lot from patients, family, friends who are affected with this chronic condition. So I wanted to present some information, some tips and tricks that you can incorporate in your own lifestyle to prevent diabetes, or if you have it, to help control and manage the symptoms, especially with this chronic condition, which can often lead to more serious complications. So I'm going to start by just sharing my screen. So hope everyone should be able to see this. So just in case if you don't know who I am, my name is Jean Thorpe-Williams. I'm a nurse practitioner, a nurse. I've been a nurse for over 10 years, a nurse for almost 15 years, and a nurse practitioner for over 10 years. I've worked mostly in acute care setting, but as I continue on my career path, I realized that the area of health and wellness, preventative health, managing patients more from an outpatient perspective has appealed more to me. And since then, I've started my health and wellness company called Adaptive Health. So today, I will be coming to you from my company, Adaptive Health, to present this information. So I hope you find it helpful. And if you have any questions, you can send me an email. I'll show my contact information at the end. So before we get started on the topic of health and wellness, on diabetes, I wanted to just give some overview on health and wellness. According to the World Health Organization, health is not just a state of complete physical, mental, social well-being, and it is a state of complete physical, mental, and social well-being, and not just the mere absence of disease. So a lot of times, just because you don't have a disease doesn't mean that you're healthy. And in the case of diabetes, it also means that improving your health and wellness can occur by incorporating strategies and modification interventions so that you can reduce the risk of either getting the disease or prevent further complication. And especially as it relates to the topic of diabetes, it also means that living the best possible life, whether you have this disease or not. So general topics to improve the overall health includes moderate activity, keeping a food diary, eating healthy meals and snacks, as well as making sure that you're getting an adequate amount of sleep. And this typically means 6 to 8 hours for most people, or many. And then also making sure that you're drinking, hydrating at least with at least 6 to 8 cups of water. So those are just general healthy habits to improve overall health. But what we find out is that these same overall habits can also help with your diabetes management. This is just a larger view of the what I call the wellness wheel, and it shows the 8 areas of wellness, the 8 dimensions of wellness. As we think about our overall health and wellness, we want to make sure that we're looking at all the 8 spectrum of wellness. And today, because we're looking at diabetes management, that specifically targets the physical. And as a nurse practitioner and health and wellness coach, that's the area that I'm most passionate and knowledgeable about. So that's what we're going to focus on today. Diabetes. What is diabetes? A lot of people have heard the terms. You have probably likely encountered a lot of family members who have diabetes. And as a result, some people know and some people may not know. So I'll try to break it down as simple as possible. Also, just a key note, a lot of people, especially in our Caribbean population, call diabetes sugar. So it's the same thing. So diabetes is a chronic, long-standing health condition, and it affects basically how your body burns food into energy. So you have 3 different types, and based on the type that you have, the body will do something differently. So for most of the time when we eat food, food is broken down into sugar, which is also called glucose, and that gets released in our bloodstream. When your body has the sugar, your pancreas releases something that's called insulin. It's a hormone, and the insulin basically breaks down the sugar so your body is able to use it as energy. That's the process of eating. And then in a nutshell, diabetes means that you do not have insulin, or you don't have adequate amount of insulin to break down this glucose carbohydrate. So that gives you all the symptoms that occur with diabetes because your body is not able to break down the sugar. And as a result, which is what happens when you get your blood sugar checked, it's elevated. Also, your hemoglobin. So those blood tests, which usually include the glucose or your hemoglobin A1C, that checks the longer range of over 3 months. Those numbers provide your healthcare practitioner kind of a snapshot of how your body is processing sugar. And if it's elevated, especially if it's a fasting glucose, it shows that you were having some malfunction in that whole pathway. And that's what diabetes is in a nutshell. There's no particular cure for diabetes, but there are lifestyle modification that you can use to reduce the risk factors, prevent further complications, and many people have been able to stop taking their diabetes medicine. And that's what I want, and that's why I wanted to do this recording, because I want to provide the information that family and friends, as well as clients and patients, can use and hopefully incorporate in their lifestyle journey. So that's diabetes in a nutshell. Now we go on to the 3 different types of diabetes. Let me just show that. So we have type 1, type 2, and gestational diabetes. So the difference with these are type 1 typically occurs during childhood or young adult. It means that the pancreas does not secrete any insulin, and as a result, your body is dependent on insulin. So those are the people typically on injection or insulin pump. It occurs, like I said before, a lot of times in early childhood or young adults. So those persons with diabetes type 1 always has to take insulin. Then you have the type 2, which is more prevalent in our society, especially today where we have higher incidence of obesity. Our diet is not the healthiest, so we're seeing higher incidence of diabetes type 2. And that basically means that your body is not able to produce the amount, to process the amount of glucose in your body, so that it tends to be elevated most times. So those patients generally start with medication management. Well, let me go back. Your provider should usually start lifestyle modification, and if that does not work, then they'll start medication and then hopefully prevent it from going to insulin. And then the 3rd type is the gestational diabetes. That occurs in pregnant women who not most times have never had diabetes. It occurs just during the birth period. It could also put your baby at risk for having diabetes, but most of the time it goes away after the baby is born. But just to note, it can increase your risk of diabetes type 2, and also some babies born, especially if there was some issues with obesity with the mom during birth, also have the tendency to have obesity as teen or young adults. So those are the 3 different types. So with having diabetes, you have this. So what does that mean? The important thing is that now you need to manage the diabetes, because most times when you're just diagnosed with diabetes, you don't necessarily have symptoms. Some people will have the symptoms of the thirst, frequent urination, tiredness, lethargy, or tiredness. What else? Thirst, increased thirst. But not all the time they have those symptoms. But and those are kind of symptoms that can be controlled, but our goal is to prevent further complications. And some of the major complications of diabetes are, you want to prevent the kidney malfunction, which could further lead to chronic kidney disease. The eyes, diabetes attack the eyes, so you want to prevent complications. Neuropathy, and that's when you have that pins and needles and numbness and tingling that a lot of diabetics talk about, that they feel in their fingers and their toes. And um, and the worst complication of that is when they start to lose feelings in their toes, and that can lead to amputation. I don't know if you've seen, especially in, I remember growing up in Jamaica, a lot of times you'll see a diabetic, and because it's not controlled or not managed with medication, it could lead to amputation of the toes, or as it progresses, it could mean amputation of the limbs. So those are complications that we want to prevent as much as possible. And this is why it's so important to make sure that we are doing everything that we can to control our diabetes, and hopefully, I, I don't necessarily use the word reverse it, but control it to the point. I know people where it's been controlled, where they have been able to get off their medications with lifestyle modification. And that's what we want to do. So just some additional information about diabetes management. Um, so what I said before in the beginning is that it incorporates some of the same strategies that included overall health. So healthy, making sure that you're getting an adequate amount of fruits and vegetable, exercise, reducing stress, hydration. So some of those simple steps that we use to improve overall health, we want to incorporate when we think about managing our diabetes. So to start with, what we do in the nursing world is making sure that you're doing an assessment. And what this means that it's knowing your numbers. It's so important to know your numbers. So what providers are generally looking at is your height and weight, because that will give us our BMI. You also want to look at the waist circumference, the measurement that gives you information as far as the risk, cardiovascular risk, which often accompany diabetic risk factors, blood pressure, and then the two specifically relates to diabetes are glucose and your hemoglobin A1C. And the glucose is just the sugar that's in the blood. Typically that's done as fasting. So if you're going to go to the lab, you want to make sure it's in the morning after you've fasted for at least 8 to 12 hours. And then your hemoglobin A1C gives a picture of how your glucose has been managed over a 3-month period. Your LDL, HDL, and cholesterol are more for the your cholesterol numbers as it relates to cardiovascular risk factors, but also important because a lot of times you'll see the two go hand in hand, diabetes and heart disease, hypertension. When we think about starting on our journey to manage our diabetes, we want to set goals for ourselves, and that's going to look different for everyone. But it's important to incorporate these objectives when we look at our goals, making sure that they're specific, measurable, attainable, relevant in time. So for today, if your glucose is 300 and normal is anything less than 120. So for your diabetes, you want to make sure that you set specific goals such as, what am I going to measure? What is the specific time frame? How is it attainable? How is it relevant? And the time factor. So I want to reduce it to this number by a specific time. And you set that goal for yourself and work towards your goal. And obviously you're doing this with your provider. Everything that you're doing, you're working hand in hand with your provider so that you can accomplish the goals that you set for yourself. This is just a tracker that you can use. I included here because it's good to write down your goals. When you write it down, you look at it and you make a commitment to yourself to obtain the goal. And also, it's good to share with family and friends so that they support you as you go on this journey to manage your diabetes. So with looking at our healthy eating, we want to look at the healthy eating plate. So typically a plate is 9-inch dinner plate. You always, and this looks different, just to take note, this looks different from the regular healthy plate for someone who does not have diabetes, but the concept is still the same. So for a diabetic, half of that plate is going to have your non-starchy vegetable. This includes your salad, beans, broccoli, cauliflower, cabbage, carrots. Then the other quarter is going to have your lean protein, your chicken, your fish, your tofu, your beans, if you're vegan, or your eggs. And then the other quarter is your green or starchy. So you want to make sure that that part, which is what is included in that carbohydrates that tends to increase your blood glucose level, it's a quarter. And as this says, it may be, if your numbers are not controlled, it may be a good idea to skip the starch produce altogether and just double up on your veggies. I find that patients get better results by doing that. It may not be ideal, but especially if your numbers are consistently higher, you want to do everything you can do to control it and then maybe add little bits at a time. So for me, I just included this because I'm such a green smoothie I was going to say addict, but I drink a green smoothie almost every day because it's such a great way to get your 5 serving of fruits and vegetables. When you think about incorporating your greens and your vegetable, which we talk about in that half of the plate, it's such a good way to include it daily. You can use it in addition to having your meal, or if you bulk up your green smoothie with protein in the form of powder or seeds and a little bit of fruits, spinach, kale, other green vegetables, then you can also make it a complete meal so that you're not skipping meal. And it's something quick that you can travel with, especially if you're a busy schedule. And then I have a simple recipe here that I use often, and it's easily replaceable with different fruits and vegetables. And some of the lifestyle interventions that we can incorporate when we think about healthy eating is drinking more water, eating less sugar, fat, alcohol, eat more whole grains and fiber, and eat more fruits and vegetables, which is what we talk about we can get in our smoothie. So I showed you the first healthy plate. I'll just go back to that. And then I wanted to spend a little time talking about this healthy plate that I found from the Ministry of Health in Jamaica, because what I found in my research is that there's lots of information on diabetes, but if you're going to present this information to patients who are from Caribbean background, African background, or even in African American background, typically a lot of the food choice and the options kind of go over their head. You cannot tell someone who's been eating bread or certain starch and rice that they need to cut all this out. You're going to have to work with your clients, your patients, your family and friends to make slow changes so that they can start to adapt a lifestyle that includes healthier options, but also include some of their favorite meals and fruits and snacks, because what we have here in America may not be what other people have in the Caribbean. And if they're here and they have not been used to eating certain food, they may not be willing to try it. And so we're not going to get the results. And likewise, if someone is in the Caribbean or Africa or another South American country that don't have the food that we're presenting to them, then it's not going to be as effective. So I love this plate that I found on the website, the Ministry of Health for Jamaica. So it shows the same kind of, um, the same aspect of how to eat and how your plate should be divided, where it has lots of vegetable, but as you notice, it has some of the different kinds. So it has pumpkin and carrots, um, fruits. We have some tropical fruits. So you have the papaya, the melon, bananas. So some of those things, it's shown that still reduced, but it's also showing you some of the other options. Staples include some of the carbohydrates in the bread and this is breadfruit. So you may not see this in America, but it's important to incorporate options that people from other countries can include. And not only if they live in those countries, but also if they live in America, because that's what they're used to. And we want to get the results by encouraging clients and patients to make slow changes so that they can become sustainable. You don't want to go in and say, stop eating this, this, and this, but may reduce this and incorporate that so that we can get better results. So I thought that was very helpful and gave a lot of insights. It also has the cup of water, which is highly encouraged to make sure you're getting a lot of hydration, especially if you're diabetic. From the same Ministry of Health also gave some insight. So it gave you simple, instead of this, so not, and one of the suggestions is that the information in red, you should limit. So it's not saying eliminate it altogether because that may not be realistic. You cannot go in and say, do not have any kind of sweet beverages because that may be the only thing someone has here in America or in the Caribbean or African countries. Instead of saying don't eat fatty meat, so you say limit instead of this and trim off as much as possible. Another example, instead of using seasoned salt, a lot of our diets in the Caribbean include a lot of salt. So you can give suggestions, use vinegar, fresh herbs, spices. One that relates specifically to diabetes that I thought was so helpful. Instead of, you limit the cakes, the pastry, the frosted cereal, sweet biscuits, and make suggestions that maybe the only thing they have are crackers. So use the crackers that's not necessarily sweet and include more nuts and beans and plain biscuits. So I love this because it just gives you suggestion. I can talk about a green smoothie every day, but if you live in the islands and you don't have spinach or have access to green apples or pineapple to make that green smoothie, then all that goes out to the window. And like I said, that applies to America too. There's certain areas that are considered food desert that don't have, people don't have access to supermarket within walking distance or supermarket that they can get fresh or frozen vegetables and fruits. They don't have access to that. So it's important to make sure that you're making these suggestions and knowing what your patients have access to, because all that comes into play. You cannot tell someone to consume fresh fruits and vegetables if they have no access to that, or more important, if they don't have the finances to get that. So always make sure that you're keeping that in mind as you work with your clients. So for diabetic, it's important, when you're diabetic, it's important that you're meal planning. And what this looks like is coming up with a list and what your list of what you're going to eat for a day-to-day or a week. It's super important and helpful if you can map it out for the week, because what this does is prevent you from just picking something up that may not give you the results that you want. So this is just an example. You would list out your fruits, vegetable, protein, whole grains, what you are going to consume for the week, so that you can have a plan. And when you have a plan, you're likely to stick to it, especially if it's written down. The next, in conjunction with diabetic meal planning, you also want to make sure that you're making a grocery list, because the grocery list would provide you with a list of food that are going to be be a part of your plan so that you can stick to it. When you don't have a list, what I find is that patients go and they're buying all these different things that may not be the healthiest thing to consume once you have diabetes. And once you find out what those are, just keep a running list so that you know when you're going to the grocery store, that's what you're going to get and that's what you're going to stick to. It's important also to start reading labels, making sure you know what the serving, each serving includes and know what that means. Also, that's included in that is counting your carbs, and that takes some some working together with your provider to using the exchange points. Some people are able to do it. I know some people think it's very complicated, but if you work with your provider, and a lot of times your provider could either refer you to a nutritionist to make sure that you're really understanding the component of your numbers, what it includes and what is appropriate for you so that you can get the numbers that you want. Another factor when it comes to meal plan, which is important, is eating out. A lot of people get into problems when they go out to eat. They do really well at home and they go out and it just goes haywire. And it doesn't mean that you cannot go out to eat, but have a plan. And what this means is that look at the menu beforehand. Look at what appetizers may not have as higher content as sugar as others. Make adjustment. If there's dessert and you want to have it, you may have half at the restaurant and take the other half home, or you may split it with someone. Try to avoid the bread, the high carb content entrees, and also make sure you're drinking your water. So instead of the sugary drink, have the water instead so that you can enjoy your meal. These are some logs that I include. So it's so important as a diabetic to make sure, especially in the beginning, that you're logging everything. You want to make sure that you're logging your food as it relates so that you can see the correlation what you eat and how it affects your blood sugar. Of course, I don't have the blood sugar log, but you should have that if you're checking your blood sugar based on frequency determined by your provider. During my nurse practitioner rotation, I did one of my clinical rotation was an endocrinologist office. And I really saw the difference in patients who kept a log of what they ate, kept a blood sugar log, made the correlation, adjusted their meals accordingly. I really saw the difference in how much better their numbers were compared to the patients who did not track anything that they eat or track their blood glucose. It's so important. And even more important, we saw the difference with the complication. So for a patient who did not necessarily track their food, track their blood sugar, we saw the early complication of the eye issues. They started having diabetic early kidney malfunction. So they have those early onset chronic kidney disease starting at stage 1 and progressing. We saw the complication of the neuropathy, the pins and needle sensation, and then the other complications. There was a specific high correlation between the two. So it's so important that you're tracking everything and taking note and working specifically with your provider. This is just a water log, making sure that you're getting adequate hydration, which will be very important to managing your diabetes. And then we get to the topic of movement. Movement is so critical. It's important that you're getting moderate or vigorous activity so that you can help your body to process that glucose that it is having difficulty processing and reducing. So physical activity is very important. For the activity, there's now the new recommendation to do at least 150 minutes over the 1 week. I say make it simple. Make it simple. Do at least 30 minutes of activity, 5 to 7 days. You don't have to do it every day, but at least five, at least 5, 6. If you want to do it 7, it's fine. Some people say they don't have a gym or they don't have treadmill. I've been doing a walk-in activity indoors because it's cold and I don't necessarily like to walk outside. So you can do a walk in 30 minutes and I burn up a sweat doing that. This is a simple, some strength training squats using all body weights except for the dumbbell, but jumping jacks, planks, everything to help strengthen your core, your body, so that you're always just moving and burning up energy, which not just for diabetes, but overall health. This is so important. This is just a list with some physical activities. Sometimes people say, I don't have time to work out. It doesn't necessarily have to be working out in a gym or at home. It includes walking, dancing, swimming, tennis if you like, push-ups, weightlifting, yoga, Pilates. Also includes exercise if you're home gardening or working with resistance bands. So many things that you can do. And this just kind of separated into aerobic, muscle strength, and flexibility, because all these three components are important for your physical endurance and activity. And then, of course, tracking it. I find that tracking it is so important because if you don't write it down, a lot of times it does not get done. And last but not least, when it comes to your overall health, and especially with diabetes, we want to make sure that we're practicing self care activities that can renew you physically as well as mentally and emotionally, spiritually. So some of these includes going for a walk, listening to music, playing with your pets, having a warm shower bath, journaling, using essential oils, writing a bucket list, making a vision boards, all simple fun activities that a lot of times we just overlook because our schedules are so busy. But it's so important to make sure that we're incorporating these other strategies. This one, taking a nap, is so important. When I take a nap during the day, I feel invigorated, I feel renewed, refreshed, and it's something that I don't get to do as often enough, but it's so important. And of course, more logs. I love writing everything down. I know people use their electronic devices or computer, but I like paper. I like to check colors. So this includes your high intensity activity, your meal plan. Did you drink your 6 cup of water? Did you get at least 6 to 8 hours of sleep? And just making check boxes. And that's it. So that's the last point I wanted to just wrap up. Make sure that you're incorporating your self-care activity along with your exercise and dietary recommendation to manage diabetes. And even if you don't, even if you're a caregiver or you were recently told that you may be pre-diabetic, these are things that you can do so that you can prevent the further complications so that we can stay as healthy and whole as possible. And this is my contact information. Once again, my name is Jean. If you have any questions, you can reach out to me, send me a message, or leave me, you can give me a call. Thank you so much for watching this. And I wish and pray for you the happiest and healthiest journey as you embark on this opportunity to take control, reclaim your health so that you live the best life ever. Thank you.